Hi, good evening, everyone. Hi, good evening, everyone, and a very warm welcome to this webinar on recent advances in management of autism, cerebral palsy, and other neurodevelopmental disorders. What is new in this field? What do we know? What did we traditionally know? What more do we know now? And how does it help us look at children differently, look at their treatment differently, look at them, their potential differently? That's what I'm going to discuss in this webinar. My name is Dr. Nandini Gokul Chandran, known as Dr. Nandini. My other name, the second name is very long, so remember me as Dr. Nandini. And I am the Deputy Director of NeuroGen Brain and Spine Institute, which is in Mumbai, in Navi Mumbai, in India. And I specialize in regenerative medicine and especially for neurological conditions. So that is my specialty. So today we are going to talk about recent advances as well as what is traditionally known, as I said. So let's go on this journey of knowing more. So why are we here? Why are you interested? Why are so many people spending their afternoon in this webinar, maybe an hour, 2 hour? That is because we have either a child with a neurological problem at home, or you know somebody who has a certain condition, or you are a caretaker, or you are a physician, or you are a therapist who wants to know, who is looking at knowing and understanding what more is known in the world. So I'm going to talk a lot about scientific data, which is available. Many people feel there is nothing, but there is so much to know and learn. So what is the current protocol process that happens that when your child is different, you notice that your child either doesn't have eye contact or was speaking a few words and regressed, or in some cases, the child is not developing physically, or even if the child is developed physically, likes to play on his own, then what do? You go to different doctors and therapists, you get different assessments done. Doctor advises you that, okay, this is a diagnosis. It could be an autism, or it could be a ADHD, or it could be a slow learner, or it could be a cerebral palsy or intellectual disability, and do rehabilitation, do therapy. Okay, very rarely is an MRI or a brain scan done, or usually an MRI which is done broadly, the brain structure is normal. So you do therapy and you're told that these are the therapies and you have to live with this condition with your child lifelong. So the therapy continues and you see some improvement, but maybe less. You see that the progress is very slow, and that leaves you with a lot of worry as to what can be done for my children. What is there? Nothing else? Isn't there definitive treatment? What am I really treating here? Because I can see that my child is otherwise whole and healthy, is running around, but really, what is wrong? So this is what we are going to learn today. So the current treatment paradigm is that there is no cure for neurological condition. That's what you keep hearing, right? When you go for a consultation, you are told there is no cure, there is no treatment, there is no medicine, there is no surgery, there is no like if there is a brain tumor, you can open up the brain and you can remove the tumor. But here there is nothing wrong in the brain that you can remove something and the child becomes okay. There is only rehabilitation and there is no medicines. Okay, the medicines, if at all, they help the symptoms or help the epilepsy, but really all you have with you is the neurorehabilitation or rehabilitation. So hearing this, actually, it gives a lot of shock to the parents, especially the first timers. And we have had parents coming to us really depressed and giving up even before starting the therapy. So, I believe that everybody should get a way ahead, a plan ahead. There should be a roadmap as to what are you looking at, even if it's just rehabilitation. What are the options that you have? Why do you need to do rehabilitation? Why is it important to do rehabilitation? This is necessary to understand. So when we look at the brain of a child with autism, I'm speaking specifically of autism here, we and cerebral palsy and intellectual, so basically neurodevelopmental conditions, we find that the MRI is normal, that the structure of the brain is normal. So let me show you. Okay, this is a model of the brain, and when you open up, this is the skull, right? And when you open up the brain, you can see the brain inside like this. So the structure is fine in most children with autism. But when you look at the functioning, here you can see a brain scan which shows functioning of the brain, known as a PET CT scan. you can see that the blue areas that you see are affected, the green one is normal. So these are the blue areas which so far we have been told that it's not possible to correct, but this blue area, it is possible to correct, convert it into green, that means active and healthy brain. So how is it possible? It is possible with a combination of cellular therapy. Along with rehabilitation therapies and integrative therapies, right? So now what are these? So cellular therapy is the center of the newer treatments, but you do know about rehabilitation, right? Most parents have heard about and have been doing for years together occupational therapy, physiotherapy, speech therapy, ABA or behavioral therapy, sensory integration, newer treatments like aquatic therapy, art-based therapy. This is an important part of the treatment, and then you add cellular therapy and you add integrative therapy like hyperbaric oxygen therapy, ozone therapy, and other vitamin supplementation. So what's new in this treatment? Rehabilitation is the conventional treatment. What's new is a new team members, cellular therapy and integrative therapy. So I call this, and we call this as that it's a team game. Treating a child with neurodevelopmental condition is a team game. One doctor or one therapist alone cannot treat a child successfully. So just like a football is a team game, or hockey is a team game, or cricket is a team game, you need a good team. So rehabilitation is an experienced team member. Rehabilitation is a tried and tested team member, but somewhere it needs more support. You need in the team of your child's treatment new blood, new enthusiasm, new know-how, new technology. And that's where cellular therapy and integrated therapy adds on to the neurorehabilitation. So, experienced team member cannot be replaced and should not be replaced. What we can do is pump in new blood with a combination of newer treatments. But also, a word of caution, it's very important to put together a team which works in complementation to each other, which works combinatorily. Otherwise, there are so many new team members which is possible to include in your team, but they should work in alignment. So that's where the protocol that we have been studying for years together and put together is now a beautiful combination of cellular therapy along with rehabilitation and integrated therapy. And I'm going to expand more on this. So, why is it important to have this team member? Why rehab alone is not enough is, for example, when you have a fracture of the leg, you can see a fracture here. And suppose in a fractured leg, you start walking or you start doing physiotherapy. Will it help you? Won't it worsen your fracture? Won't it cause more swelling? Right? So, what do you actually need to do? You need to fix this fracture. And once the fracture is healed, once it is fixed, now you do the physiotherapy. Now the muscles will strengthen and you will be able to walk and hopefully run again the way you were. So, similarly for the brain is also an organ in our body which needs to be healed. And when we look at the brain of a child with autism or cerebral palsy, we see that the blue areas that here denotes the damage or the low functioning or the inflamed areas of the brain. And we believe that when you heal this, you can see that here the green is starting to come up as the brain heals. Now you do the rehabilitation, now you do the therapy. The child will learn faster, develop faster. What you see in 1 year, 2 years, you start seeing in 3 to 6 months. So, what is the old thinking? The old thinking is that once the nervous system is damaged, it is incapable of regeneration. But that is old thought process, right? Long time back, when we were kids, or even before we were born, it was a general thinking that you should not travel across the seas. That was Indian culture. So if you travel across the seas, then it is a sin. But now the whole thinking has changed. Yeah, every day we travel different directions. We travel maybe across multiple seas. Yeah, so the new thinking and the new evidence which is coming has come in for the last 15-20 years is that regeneration in the brain is possible albeit it needs some push, it needs some help through the process of cellular replacement and repair. So, what was the old view? That only rehabilitation, so experience is enough, experience know how is enough. But the new view is that with the experience, you need the new technology, the cellular therapy and the integrated therapy. Now, this three is a very strong combination, and the new view is that now it is possible to reverse autism, it is possible to reverse cerebral palsy, it is possible to get the brain to regenerate and revive. And I will show you examples of these. So cellular therapy is not a science fiction. I keep telling it is a idea whose time has come. It is something which is now available. Now, treatment available usually in the field of modern medicine, you know that either it is medicine or it is an injection or a medicinal product. So, tablet, syrup, capsule, injection. That's one way of treating any condition. The other way of treating that you know is surgical procedure. You cut, you stitch, you remove stuff. But cellular therapy is a third paradigm. It is a third type of treatment, which is neither a medicine nor a cut stitch surgery. It is a procedure known as cellular transplantation. So, this gives us a hope without just medicine, without a big surgery, to get a child who is sitting on a wheelchair to stand and walk, a child who is unable to go to school and study. So cell therapy with the tool of stem cells is where you get there's a stem of a tree, just like a stem of a tree gives rise to branches and gives rise to leaves, flowers, and fruits. We have cells in our body which can multiply many-fold, and depending on where you put them, they can give rise to that type of uh, cell. For example, if you put them in the liver, it can become liver-like cell. If you put them in the muscle, they can stimulate the muscles. If you put them in the brain cells will divide and multiply and regenerate and revive their connections. But you need growth factors, you need the fertilizer, you need the rehabilitation to help this tree grow. So that's why the combination. So what are these cells? What are these special cells? These special cells, what is the function and what is the characteristic? These cells have special abilities that one cell can multiply into many, many. Depending on where you put them, they can become the type of cell which is there in the environment. They improve blood supply, they release positive chemicals so that the cells around who are functioning low can get stimulated and work better. Like nerve growth factors and brain-derived neurotrophic factors, they stimulate the brain cells to repair. And these special cells have these chemicals to stimulate other cells. So those inactive cells which you see in the blue on the brain scan, which I showed you, will get revived. They will start becoming active so that now when you train them, they will start connecting and networking. So how are these different from any medicine? Let us look at a very simple example. Like way back in 1990, if you had to calculate something, you would need a calculator, right? If you needed to click a picture, you would need a camera. If you needed to video shoot, you needed a video camera. If you needed to listen to music, you needed um, a musical instrument, right? And if you needed to watch television, then you needed a television set. If you need to use a computer, you needed a PC. If wanted to read a book, you needed a hardbound book. But now, in the current age, in 2024, what do we have? That one phone, whether it's an Android or iPhone, can perform all these functions. That's what the special cells are. That's what they do. They have multiple functions. They have the function of stimulating other cells. They have the function of forming new blood vessels. They have the function of preventing cell death of the current cells. So they have multiple action, and that's their specialty. So the cellular therapy or regenerative medicine is a promising therapeutic modality which can help the damaged cells or damaged brain be replaced so that healthy cells become more active. So, what are the major types of these cells? The major type is one, embryonic stem cells taken from the embryo when there is in vitro fertilization. You know about test tube babies, and couples cannot have children. There is a for test tube babies, and test tube babies, 10 to 12 embryos are created outside, and 3 to 4 are put in the mother's womb. What is remains outside goes into waste. If those cells are then multiplied in the laboratory, a tissue culture lab, you get these special cells which can form any tissue of the body and have the potential to form practically all cells of an embryo. However, these cells, though have a lot of promise, they also have possible tumor formation or teratoma formation. And more importantly, there are ethical issues surrounding these because there are certain ways of thinking which suggest that even killing or discarding or using an embryo which would have otherwise been discarded is like killing an embryo. So ethically, there are question mark, and hence treatment or translational medicine using this form of cells is not a feasible option. The second form is the cord blood, and cord blood is very commonly now stored in special laboratories. We do know about them that the cord, which connects the mother and the child, does have cells of the child, not so much the mother, but of the child, and is a rich source of stem cells for blood disorders or hematopoietic disorders. Sibling transplantation, sibling cord blood transplantation is a well-known possibility. Other indications for using cord blood could be autism and cerebral palsy. However, these cells only can be given intravenously and cannot be put directly into the brain. Why? Because these cells are stored in minus 190 degrees centigrade. You can imagine, minus 1, minus 2 itself, you will freeze to death. And in minus 190 degrees centigrade, the cells have to be kept alive. How are they kept alive? They're kept alive by mixing the cells with a cryopreservant known as dimethyl sulfoxide or DMSO. This is an extremely toxic chemical for our cells, for our body at our temperature, at room temperature. However, in cold environment, this chemical keeps the cells alive. When we have to use it on a patient, we need to retrieve it outside, wash the chemical completely. Otherwise, even one drop can cause a severe reaction. Hence, very careful. We have to be very careful by using this. The third option that we have, which is feasible both in terms of ethical clearance as well as no chemical mixing, is the adult stem cells. The adult cells taken from our bone marrow, from our teeth, our fat, are good potential sources of cells to be used for repair of our body organs. And there are no ethical issues. We are not killing an embryo, and hence these cells are very, very potentially useful. So when we hear that one, stem cell is banned, number two, stem cell is experimental, number three, it is still being researched, what we are, or there is the stem cell is illegal, what we are doing is we are putting all beverages in one basket. Would you say that homemade orange juice, Tropicana, or packaged fruit and alcohol are all beverages, and hence they all have either toxicity or side effects or need licensing? What is the correct treatment? It is partially correct. It is not completely incorrect. However, that does not really bring out the truth. So what are we looking at here? We are looking at adult cells taken from our own body, prepared in the laboratory without any chemical mixing. It's like homemade orange juice. A homemade orange juice made by the mother with lot of love. Will it, cause any problem to the child nutritionally? No. Does it need licensing? Do you need license to give it to your child? No. But if the same orange juice in the factory is packaged, it will need FDA approval. And that's like using a cord blood cell because it is stored at minus 190 degrees. The third is the embryonic stem cell. Is like alcohol. It needs different kind of licensing because it has different issues altogether. So you need to understand that we can't really generalize. Every type of cell or every type of source of cellular tissue has different requirements. It has different licensing requirement. It has different connotations. It has different pros and cons. So it's very important to know where are you taking the cell from, what are you doing to it, and where are you putting it. These are three questions you must ask. So we at NeuroGen are using cells from the patient's own body in clinical setting because these are safe, they are non-tumorogenic, they have never been known to form tumors, there is no rejection issue, these are easily obtainable using a very thin needle, no cut, no stitches, and no ethical issue because we are not killing an embryo. This is a replenishable source of cells in our body. Like when we donate blood, more is formed. Where is it formed? In the bone marrow. So when we remove part of the bone marrow continues to multiply and creates fresh cells within a day or two. And this is the source of the cells. Now, what do we do with it? We separate a certain part of the cells, which is a cocktail of cells known as mononuclear cells. And these cells are then injected into the lower back, into the spinal fluid, and in the same patient. Why? Because we want to reach the brain. And hence, this is known as minimally invasive. There is no cut, there is no stitches. It is safe because we are not going into the brain. There are no major side effects. The cells will go directly to the brain or spine wherever the damage is. It will not get diluted into the liver, into the lungs, or into the gut if there is an injury elsewhere in the body. So what are we doing? We're directing the cells to go where of its own through the bloodstream it cannot go. Many people do ask me that if these cells are there in our bone marrow, why don't they reach the brain themselves? So now let's look at what does a bone marrow do. Many of you who are non-vegetarians and who eat non-veg and chew the chicken or the goat bone would know that this bone is hollow and that's where the bone marrow resides. Here, what is the bone marrow doing? Bone marrow is producing newer cells. Where is it producing from? It is producing from a source of immature cells or kid cells which are there in the bone marrow. They multiply, they divide and multiply, and they form adult cells, adult blood cells like white cells and red cells and platelets which go into the bloodstream. So from the bone marrow, when the cells go out, they are adult. But when the bone marrow cells are in the bone marrow, they are immature stem cells or kids. You understand this? So when in the bloodstream, when the bloodstream reaches the brain, it has mostly adult cells. That is one part. So we don't get immature cells or young cells which have the potential to stimulate and become other cells in the blood. They are mostly in the bone marrow. So suppose these cells were in the blood, would they reach the brain? So they have to go through various, they have to go through the lungs, through the heart, through the liver. And when they reach the brain is surrounded by meninges. It is surrounded by coverings. And these coverings are very protective. And even if the blood goes there, only the soluble chemicals or oxygen diffuses into the blood, into the CSF or into the brain. But the cells cannot go there. So that's the natural way of the nature to protect our brain. And hence, what we need to do is take the bone marrow, separate the cells, and inject it into the spinal fluid that you see here so that it can cross the blood-brain barrier and be able to reach the brain with minimal interference. So that's about why we put the cells into the spinal fluid. So what is the scientific basis of this cellular therapy or regenerative medicine? Is it something which has just come up in the last years or so? No, it has been a research for the last at least 30-35 years now, or maybe 60 years if you look at it, because Dr. Thomas was awarded the Nobel Prize for demonstration of stem cells in the bone marrow the year 1990. That means he must have worked at least 20-25 years before that, before getting the Nobel Prize, right? The second Nobel Prize on the derivation or isolation of embryonic stem cell was awarded to Sir Martin Evans in 2007. And in 2012, a new concept of induced pluripotent stem cells or designer stem cells or customized stem cells was given to two scientists, one in the US, one in Japan, for a path-breaking evolution or understanding or innovation. So a lot of research has happened, is happening, and it is not something which has come up overnight. At NeuroGen, we have published almost 109, 110 scientific publications in various national and international peer-reviewed journals. What does peer-reviewed mean? It means that our data goes to the scientific journal, and our peers who are experts in their own field and in the field of regeneration review our data. If they find it authentic, then it is published in the journal. Like this, we have published 16 articles in autism, 15 in cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy, and 9 in spinal cord injury. So all the major conditions that we treat, we have scientific publications. We have also been invited to write book chapters in textbooks on, for example, recent advances in autism. We were invited to write a book chapter on stem cell therapy in autism. We were invited to write a book chapter in a book known as Cerebral Palsy Challenges for the Future, again about cellular therapy, in a book known as Physical Disabilities in Muscular Dystrophy. So because of our experience in this condition, in using of regenerative medicine and cellular therapy. Now, Government of India also at the highest level supports regenerative medicine. Shri Narendra Modi, our Prime Minister, in fact, has visited the lab of the Nobel laureate Professor Yamanaka in Kyoto University in the year 2014 to understand how induced pluripotent stem cells can be used for various blood disorders. He came back and he suggested and he ensured that a laboratory specifically in Bangalore would do this work and take it ahead in India. This is the book that we have written, which is being gifted by Professor Alok Sharma, our director, to our Prime Minister. He's also written, the Prime Minister has also written a preface for our book in Gujarati on muscular dystrophy, and he's also spoke in the parliament.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट यामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहाँ गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है।
So a lot of positive influence from the premier of the nation as well. Now, how is this treatment done? Just with all this background, I hope you've got some sense of what this field is, where is it going. Now, the treatment is very simple. Most parents, of course, worry, what does it mean? How do you subject a child to a lot of cut and stitches? No, the treatment is very, very simple. It is done in 3 simple steps. One is the aspiration of the bone marrow from the hip bone. From the hip bone here, we take the bone marrow. You can see the bone here. This bone is very thick. A very small needle goes in and sucks out the bone marrow. Then this is processed in the laboratory in a few hours, and then the cells which are separated are injected in the lower back. Let me show you a video which demonstrates. You can see the bone marrow, child is sleeping well. Then it is processed in the laboratory. It is centrifuge. It divides into different layers. The lowermost is the red blood cell. In between, you get the mononuclear cell or the white cells. And then above that is the plasma. What we need is the central part that is separated, and this pinkish white ball of cells, millions of cells, are then injected using a very thin needle in the lower back. You won't even see a mark there. So bone marrow aspiration separated in the laboratory. These are the cells. Finally, that we get millions of these cells counted and injected into the lower back. So along with that, of course, we do a lot of integrative therapy. A little introduction about the integrative therapy. This is the other team member, as I call. We keep on looking at what new, what more naturally stimulating that we can do with very less chemical stimulation. We don't believe in a lot of chemical stimulation. And one of them is oxygen-based therapy or hyperbaric oxygen therapy. Now, what is hyperbaric oxygen therapy? You can see this machine, which looks like a space capsule, and in fact, many children love this and feel they are sitting in an airplane or going on a jet. This helps to improve the oxygenation of the tissue throughout the body. What we normally we do is when we breathe oxygen, when we breathe air, the air contains 20% oxygen, and 20% oxygen, when we breathe, it goes into the lungs, and the lungs purifies and takes the oxygen and pushes the carbon dioxide out, and whatever oxygen the lungs takes in is absorbed by the red cells in the blood. You can see that, right? The red cells here, this is the oxygen molecule that you are seeing. So you can't see any oxygen here outside. This is at 20% oxygen at 1 atmospheric pressure. What is 1 atmospheric pressure? The current pressure that we are breathing the oxygen in. In hyperbaric oxygen, 100% oxygen is administered at increasing pressure. So when pressure increases, you can see more oxygen is taken up by the blood, not only in the red blood cells, but also in the liquid medium. Can you see this? So much of oxygen diffusing into the liquid medium. Now imagine that this oxygen is going into your bloodstream, and it can go into small nooks and corners of your brain, of your skin, of your liver, practically regenerating or rejuvenating all your cells. And when this oxygen, it can reach even where the red blood cells cannot reach. They can in through very small capillaries, and it stimulates the stem cells in all these different small parts. So the cells that we are injecting along with the oxygen therapy together, also the life of the cells that we inject also increases the survival and the potency. So we find that combination of oxygen-based therapies is like diffuses the brain, completely saturates the brain with oxygen. Can you see here? That is at 1 atmosphere pressure, and here complete it is. So even where earlier the oxygen could not go, now in hyperbaric conditions, increased pressure condition, it goes in. So it has been used very commonly in anti-aging. What does it do in anti-aging? It helps the age of the cells to reduce. Means if your cellular age is like 80 years old because you have not taken care of your body properly, with multiple sessions of hyperbaric oxygen, you can reduce the age, make the cells younger so that they survive longer. So this is the way the oxygen therapy is done. Very simple process. The child lies in the chamber with the parent. There are, of course, other types of hyperbaric oxygen therapy known as multi mono. This is monoplace, and that is multiplace or multiple people can sit. It's like a room where you can sit, and then you get a mask, or you can get a hood where 100% oxygen at increased pressure is administered. So it also releases, increase the nitric oxide synthetase. It helps to stimulate the endothelial progenitor cells, which will eventually help repair. It increases the possibility of the tissue repair and helps the cells to engraft better, helps the cells to reach the right place, improves blood supply, it reduces inflammation, it gives the bone marrow cells a better environment, and help them reduce the inflammation in the brain as well. So oxygen therapy along with cellular therapy seems to work beautifully together. So the contraindications also you must know. If a child has active seizures, we are very cautious administering HPOT to such a child. If there is a visible implant in the outer part of our body, if there is ear perforation or grommets in the ear, if there's a fibrosis of the lung or the lung is infected severely, a present patient on oxygen support, acute ear pain or discharge, or deranged vitals like increased blood sugar or very high blood pressure. So this is, let's see how the hyperbaric monoplace hyperbaric chamber works. This is an example of an adult patient, but a child can go in with another parent. Here the child patient is going inside. They're putting earthing connector, so there is no electrocution. Then the door is closed. This door closing is very important. It has to, be very tightly shut, like no pressure should leak out. And then the pressure is slowly increased. The first session of 30 minutes will always be like a 1.2 or 1.3 atmosphere pressure. The pressure takes few or 6 minutes to 8 minutes to build up. Then you keep the patient in for some time, and then you get the pressure down to again 1 atmosphere, and only then the door is open. So the going up and going down are very critical. So generally children love it because they can watch television, they can look at their favorite cartoons, so they get the screen time, push. So that becomes very, attractive to the children, and its beauty is well tolerated by the children. The second integrative or the oxygen-based therapy is ozone therapy. That you will see here on the screen. You can see oxygen is 2O with a good tight binding here, but the third oxygen now which connects is very weak linkage, just one you can see here. So this is ozone or O3. You can see O2 and O3. Females who go to the parlor will know now there is ozone therapy or ozone facial massage. Why? Because it helps rejuvenate your face. Also, your skin heals better. So we find ozone therapy very, very useful. It is activated oxygen, medical oxygen converted to O3 or through an ozonator. It is also a gas, and it's an unstable molecule. It's a natural germicidal. It kills viruses, bacteria, and fungus. It reduces inflammation and swelling. It makes the blood thinner. It reduces the blood clotting. It is an antioxidant and thereby prevents cell damage. So it's a very excellent molecule for increasing immunity, and it can be administered in various ways. It can be administered as a sauna. It can be administered as breathing ozone through oil, that you can pass ozone through oil and breathe the fumes of the oil. You cannot breathe ozone directly. It is very toxic. It also improves gut health. When you give like an enema, it kills unwanted bacteria. It improves the blood supply in the gut. It improves the brain oxygenation when you give it through ear, like through a stethoscope, and it has multiple benefits. So this is ear insufflation. This is one way it can be given. As I said, through the nose, like sauna, can be given intravenously. Once you put it in saline, and different ways. When can we not suggest or administer ozone? In G6PD deficiency, intravenous ozone cannot be administered. In acute bleeding or active bleeding or menstrual cycle, during that time, no ozone, because it thins out the blood and may increase the bleeding. In hyperthyroid patients, cannot be. In ear insufflation, it cannot be done where there is cold or there is an ear issue, or if child has seizures or has EEG abnormal. Let's look at how ear is on. This is the medical oxygen. It goes through the ozonator, and now here the white tube, the ozone is going to the stethoscope. That's how the ozone is administered in the ear. In the rectum, it's administered like enema. Okay. Now, gut cleansing is ozone also helps in gut cleansing. In adults, we have a gut cleansing system known as hydrocolon therapy. However, that is only for adults because it has a high pressure uh, uh, blood water going into our intestine. But in children, uh, Ayurvedic or naturopathy, uh, enemas can be given. This is for adults. Then acupressure, deep tissue mobilization, stimulating certain points in our body to improve oxygenation and induce a state of relaxation. It relieves muscle tension, it elevates, activates the self-soothing mechanisms, improves blood supply. Vitamins can be administered orally and intravenously. In adults, micronutrients are administered intravenously, but in children, intravenous administration is not recommended. Only oral therapy is recommended. Now let's look at results in autism, only of cellular therapy with rehabilitation and cellular therapy with hyperbaric oxygen. So in neurodevelopmental disorders, it has been seen like autism. We know that it is neurodevelopmental disorder, and it is seen more in boys and in girls. Typically diagnosed around two-ish, 2.5 or so, between 2.5 and 3, and is a spectrum from mild to severe. Triad of symptoms: poor socialization, impaired communication, and restricted repetitive behavior. Why do we need to find a definitive treatment or cure? Because the numbers are increasing. You can see in 2004, 1 in 166, and in 2020, 1 in 54, 70 million of people on the spectrum. Recently, 2023 data is 1 in 36. So in 3 years, it has gone from 1 in 54 to 1 in 36. Isn't that really worrisome? Fundamental cause, nobody really knows for sure. It could be a combination of genetics and environment. 10% genetic is known. We do see it in families. Genetic tests have revealed some amount of associations. 90% is more of environmental causes, problems during prenatal and antenatal conditions, intestinal dysfunction in autism, exposure to toxic chemicals, use of mobile phones. Evidence is coming up, not 100% a given, but a possible contributor. So, what do we know new about autism? We understand autism better through imaging of the brain. I will talk a little bit about that, and then we will look at the results of cellular therapy. Now, the new imaging, apart from MRI, that is the PET-CT scan of the brain, tells us the functioning of the brain. We look at which areas of the brain are functioning better, and some which are not working well. You see the brain from the side view, which I showed you here, right? And you see this is the brain. When you see from the side view, let me show you the other way. I think, yeah, yeah. So you can see. So this is the main brain, the pink that you see here. On the screen, you will see it as green, yellow, and red. That is the main brain cortex. Here it's for functioning well. But you can see here lower down, the blue and green on the screen is the cerebellum. Then you can see the tip here and in between. So these three areas are working less, and they correspond to the functioning of the brain and leading to different symptoms in the child. Cerebellum is for fine motor activity, coordination, balance, articulation, sensory processing, all different kinds of senses. So this is like a traffic police of the brain. If the traffic police is not working properly, what will happen? There'll be chaos on the road. There'll be jams. That's what is happening in the brain of a child with autism. And here we can see medial temporal for understanding, learning, comprehension, socialization, emotions, emotional expression. Then in between here is a thalamus. Thalamus is important for motor and sensory processing. It's a relay center which relays information across the brain, to parts of the brain, as well as from brain down. So all this is important. We feel is just the problem in speech. However, that's not so. Overall, interpreting the cues from the surrounding, uh, taking in information, whether it's verbal and or non-verbal, from others, from the environment, that itself, the processing of information is affected. Input is normal, processing and output is affected. And this is what we have studied and published in the World Journal of Nuclear Medicine as well. A gist of what's really happening in the brain, I told you, but over a period of time, what is happening? So when you see this graph here, you can see the orange graph indicates brain of a child with autism, the metabolism or brain functioning of a child with autism, while the blue indicates brain of a neurotypical child. So when this brain functioning, you see the blue between 0 to 5 and up till 10, the brain functioning or metabolism is increasing very fast, and between 10 to 15 years it increasing but slower. When you look at brain of a child with autism, the initially it appears that the brain functioning is better, and then it keeps going down and down, and you can see that the gap between a child with autism and a neurotypical child keeps on increasing with time. Now, why is this important? This is important to understand that because it's important that we start treatment early. And why do we need to start treatment early? Because if we start treatment early, you can push this graph up. You can reduce this gap. You can get the child to mainstream faster if you start treatment early. The later we start, the bigger gap we have. It's not that it is not possible even later. It is possible, just it becomes more difficult. It's like, going against the tide. But even at later ages, it is possible to give a child with autism a better functional life. So the management of autism is not a one person job. It is a teamwork always, and it's important to get the right team together. And one of the most experienced team member is, of course, neurorehabilitation, just running through which something which you already know, ABA or applied behavioral analysis or behavioral therapy, important to help reduce behavioral issues and channelize the child's energy to appropriate activities. Physiotherapy, motor impairments are seen in autism. We may think they are not there, but we do see many children with low muscle tone, problem having gravitational insecurity, climbing stair, climbing down, jumping, running, hopping, standing on one leg. This may sound trivial, but they are important in the overall development of a child. Uh, then occupational therapy, one of the core treatment important for a child to sit and develop. What is the occupation of a child? Occupation of a child is to play. Occupation of a child is to brush his teeth, eat his food, have a bath, be able to go to the washroom, right? Dress himself. These few things are very important even before the child speaks. So, occupational therapy helps the child to become independent in activities of daily living through processes of neurodevelopmental techniques, but also through sensory integration. Sensory integration is also a part of occupational therapy. Why sensory integration? Because primarily the autism is a sensory processing disorder. We need to help, you need to teach the child to respond appropriately to the sensations that a child feels. Because generally the problem is either the child is hyposensitive or hypersensitive. What does that mean? When the child looks at a sensory information, is unable to process it appropriately, and response is either exaggerated or underplayed. Every kind, whether it's light, it's sound, it's touch, it's oromotor, chewing, smell, everything is disturbed. So we need this disturbance to get into harmony. Speech therapy. Everybody who is initially developed with autism unfortunately starts only with speech therapy. It doesn't help. So we need to integrate speech therapy with OT. Speech therapy should first focus on oromotor, tongue movement, chewing of the child, eating better, and then speech and communication. Aquatic therapy, new form. Children love water, and we've seen that when you teach things in the water, the child develops better, the child focuses better, concentration improves. Sometimes speech also gets stimulated. Art based therapy, teaching the child through the medium that the child loves. Some children love music, some children love art. Use that medium to engage the child and improve his focus. Chelation, heavy metal removal, one of the possibilities processes. Have to be very careful, be very judicious using detox methods. Supplements have to be given mindfully, check for the levels and then give. That's what we feel. Over supplementation sometimes causes more problems. Diet and nutrition, important part of the treatment. Gluten free, casein free diet has been shown to have 50% success rate. That means that in 50% of the children who resort to this type of diet, they do find improvement in better concentration, better gut health, reduction in constipation, reduction in hyperactivity. But with all of these, are we doing enough? No. That's why we need cellular therapy to focus on the brain functioning. Everything else is working from outside. Cellular therapy, along with oxygen therapy, is helping the brain heal, and then all of this works better. So, the first time ever in 2013, we published this data of 32 individuals, first time in the world, to show that autologous bone marrow derived cells, a mixture of cells, when injected intrathecally, helps in all these different domains in improving social relationship, emotional responses, development of speech, language, and communication, better behavior, better sensory responses, and better cognitive component. So we saw that a child would focus better, hyperactivity would reduce, understanding improved. Then the therapists are able to train the child better. All the therapies which were helping before but lesser or slower become more important after the cellular therapy. After the cellular therapy, the therapist finds the child is progressing and the parents find the child is progressing faster. The second publication came in 2020, where we published a data of 254 individuals in the American Journal of Stem Cells, where we found that not only does it help the symptoms, we also found that it helps in improving the functioning of the child and reducing the autism severity. Based on the severity, we did find it helps both mild to moderate and moderate to severe patients. Uh, Very, very important, our data suggests that children less than 5 years respond the best to the treatment, almost 97 to 98%. Between 5 to 10 years, about 90 to 94%, and above 10 years, I would put it 85 to 90 practically. Yes. So 90%. Gender-wise, both male and female respond equally well. The earlier you bring the child for treatment with for after diagnosis, better the response. Within a year of diagnosis, if treated, almost 100% of the children recover. When brought between 1 to 5 years, about 95% a success rate, and between 5 to 10 years after the diagnosis, about 90%. When we look at the literature or the evidence throughout the world, different type of cells used through different mediums of administration. First ever publication from India, from NeuroGen, second from China, third from Italy, fourth and fifth from US. That's why it's not so prominent in the US yet, because much behind us, almost 8 to 10 years behind. Sixth again from India, seventh Vietnam, eighth Iran, and ninth USA. 60 published articles from NeuroGen itself, and so many others from the world. No actual contraindication. You can combine with other treatments, but you may just have to space them out a little bit. The results of the most recent studies that we have sent for publication of 1,000 plus patient, and also comparing some of them with the oxygen-based therapy, we looked at 100 and 100 intervention group, meaning cellular therapy along with oxygen-based therapy and cellular therapy alone. We found that cellular therapy with integrative therapy had substantially better response in most of the symptoms as compared to cellular therapy alone. We also found overall, in terms of autism rating scale, also there is a better impact when oxygen, at least 10 oxygen session, hyperbaric oxygen sessions are given along with cellular therapy. So let's look at a few examples. This is one of our very favorite patients who was treated almost 10 years back. 2015 was his first treatment. He was 11 years at that time. The second treatment in 2017 and third in 2018. Now he's 19, almost 20 years old now. When he came to us, he had fleeting eye contact, he had low self-awareness, no response to name, a lot of sensory issues, stereotypical, self-laughing, aggressiveness, temper tantrums, all the typical indicators of autism, limited vocabulary flow, fluency, hyperactivity, poor command. Following after the treatment, within 5 months, he went from reading level of third grade, fourth month, to a reading level of seventh grade, first month. You can see this jump in 5 months. His eye contact improved, his temper tantrums reduced, stereotypical behavior reduced, his sensory issues reduced. He started enjoying water, started wearing full sleeves clothes, personal judgment, conversation, memory, independence, socialization, everything improved. Brain functioning improved beautifully. In 2 years, he could get integrated into regular school, and he started getting A's in most of the subjects, even in language. He learned not only English but Spanish also, with a GPA. He passed with a GPA of 3.833, which is, I think, great. After 7 years of treatment, no long-term side effects, because that's one of the worries of the parents. Autism. He was off the autism spectrum in about 2 to 3 years. You can see that, and now he has graduated from school. He has applied and received admissions in colleges. He was part of a choir. He traveled with the team to different parts of Europe. So that's him. That's his name, Ganesh.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the third grade, fourth month reading level to a seventh grade, first month reading level in 5 months.
This is a story of 11-year-old Ganesh. Let's look at a few more examples.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
See my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that's Mercy speaking about her children. This is a child from Kenya who came to us 2 years back when he was 13 years old completely. For 13 years he was at home. He was unmanageable. He could not be taken out, or he was running around after the treatment. Also for some time it was very difficult to manage. When he settled down, he could now go to school. For 13 years he could not go to school. He could understand. He could now he understands. He rides cycle. There's so many things that now he does. So this is a very cute child from South Africa. I love his story. When he came to us at 4 years, he was recently diagnosed, and absolutely he was had no sitting, no focus, running around, no understanding of anything, no words at all. After treatment, in an year, you could see that he's sitting, he's focusing, he's understanding colors, he started using some words. That was a year. So this is just a year progress, and I will show you what happened in 3 years after the first treatment. You will see the drastic change that he had in terms of speech and vocabulary. The next video is stupendous. It's amazing for me always.
Once upon a time, Pete the cat was walking down the street and his brand new white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes. Oh no. Pete stepped in a large pile of strawberries. What color did it turn his shoes? Red. Did Pete cry? Goodness, no. He kept walking along and singing his song. I love my red shoes, I love my red shoes, I love my red shoes.
So, can you believe it? He's the same boy who was completely non-verbal. And just see what the mother wrote here. Mother wrote, I want you to read this. She wrote that I am Lavan from South Africa, and do you remember, Zaki? I just want to thank you that all those years before the cellular therapy treatment helped to create the foundation, which was very important. That's what we believe. If you're able to early on get the brain functioning to improve, the foundation is set, then you can build. You can build a bigger, building. Keep on training the child better because now the brain is capable of taking. So other therapies, other treatments have to happen, but if they happen in the foundation after the cellular therapy, you will see the response better. So there are so many such examples. I will now go to talk a little bit about cerebral palsy. Cerebral palsy is lack of oxygen to the brain, leading to severe brain damage, probably either during pregnancy, during delivery, or immediately after birth. It can lead to various types of disabilities. It could be that just the one hand is affected, or one side of the body is affected, or just the lower part of the body is affected, or the whole body is affected, along with cognition and understanding. Based on which part of the brain is affected, there can be severe tightness, or can be complete loose, or there can be a lot of involuntary movements. Now, this is a PET scan which tells us about the damage. The black part that you see here is dead cells. These are dead. This is a dead brain. Only there is scarring. The black indicates scarring. Blue around it is salvageable. The blue around it is what the cellular therapy is going to stimulate and make it green, that is active cells. And that cells now can be trained. That's what neuroplasticity is about. That's why training or therapy after this treatment becomes very, very critical. What are the current treatments available? Medications, orthotics, that is the splints for the leg, surgery if there is very severe spasticity, if there is less spasticity, then medication or Botox, and rehabilitation, of course. But with cellular therapy, all the other therapies, what they're doing, they are helping from outside. The cellular therapy is helping to build the brain from inside. The unpublished data shows of 262 children shows various kinds of improvements in children with only lower body affected or upper body affected, and other kinds of mixed cerebral palsy. We will see a few examples and we'll see a few videos. Brain functioning, I want to show you this. So you can see the brain damage here. All these blue areas are damaged. This is before the treatment, and 6 months later you can see that the blue has become green. So the green part is now active brain. Now the brain can be trained better. You can just see a difference in before and after. So this is one of the first studies, and we have about 15 scientific papers. Let's look at videos. In fact, I will directly show you some videos where I can explain to you. This is a child who was treated by us when he was 7 years old. And in 22 months, he had the following improvement. The child who was completely unable to sit without support is now able to sit independently. A child who was not able to stand is now standing with walker and walking. A child who was not able to speak is now started speaking in sentences. Took about 22 months, but what was not happening in 7 years started happening. A child who was homeschooled, who was a physical limitation, now could go to school. His hand-eye coordination, his balance improved, command following improved, his scoring changed, from very severe to moderate. And brain functioning, look at the brain functioning. Before the treatment, you can see all these blue areas which were damaged. Now you can see the brain is now completely active. Look at a few videos. This child from Kenya who came to us, he was 14 years old when he came to us. He was cognitively all right. He was going to school, but severely physically disabled. After the treatment and with good rehabilitation, he started developing upper body strength and tightness reduced. He started using his hands better for gross motor, and then fine motor activities. Then started, ambulating, going, and doing his small things within the house. This was the initial month, and then after 2 years, you can see now he's walking independently. A child who was completely on the wheelchair is now walking without support. A 6-year-old child, in 3 years, this is the improvement that we saw. A child who had a lot of involuntary movements. He had ataxic cerebral palsy, who could not crawl, who could not sit, who could not stand, had severe movements, who could not speak, who could not understand, who did not have cognition, started understanding and learning and vocalizing and speaking, going to school. He was able to reach out with the left hand. His left hand was very poor. He could not crawl. He did full support. Started crawling and sitting and walking, wheel walking without falling down. He started sitting from floor to stool. And he would now climb to the windowsill, where he would fall down while standing and walking. He could now balance much better. He started walking with more balance, though not 100%, but much better ball. And he could even pick up ball and throw ball, and started attempting to climb stairs. The success that you get with proper, consistent follow through after the cellular therapy. A child who could not stand at all, we needed complete support for standing at the age of 7 years. With cellular therapy and rehabilitation, started first walking with support, and then walking within the house, and then walking outside the house. So this is the progression that he had over a period of a year. This is a brain scan. You can see damage before and improvement after 12 months. Child very severely damaged. Over a period of 2.5 years, you can see the subsequent cellular therapy and rehabilitation. He had no leg holding, no sitting, no crawling. They could sit better, more awareness. Hold his body better, sitting, stand, then it was gradual, better body control. The support of walking. It was a lot of commitment from the parents' side. There are many such examples in cerebral palsy also. I'm now going to go to intellectual disability, talk a little bit about intellectual disability, basically also known as mental retardation, but the word is not used anymore. Again, brain functioning is affected in such children, mainly treatment for medications and behavioral therapy and special education is the key treatment. As brain functioning improves, you see that rehabilitation works better. This is the first ever publication in the world that came from NeuroGen, which shows proof of concept of using autologous cells in intellectual disability. We divided the patient group into two parts. 29 got only rehabilitation and 29 got intervention, that is cellular therapy with rehabilitation. And we found quantifiable difference. What did we see? That in only rehabilitation group, though there was improvement in 80% of the individuals, 20 did not improve. And those 80 who did improve, only 13% improved significantly. Now, in the intervention group, we can see that all of the patients improved and 62% improved significantly. So that is the quantifiable shift that you get when you add cellular therapy to the mix of rehabilitation. This is a brain scan. You can see before the treatment, completely blue chewed up brain, almost like a cortical atrophy, and after the treatment, you can see completely green. So this is the improvement that you see. That brain is functioning better from inside. Then you do therapy from outside. It really helps. Now, publication in the scans. So these are publications. For example, a 20-year-old boy from part of India known as Andhra Pradesh. He came with an intellectual social age of 9 years when he was 20 years old. So he was behaving like a 9-year-old child. He had difficulty in reading. He could not write. He could not do outdoor games physically, though it was more of intellectual disability, also had physical issues. Unable to speak full sentences, could not do any mathematical calculation. He was not able to go outside the house independently. He could not buy any groceries. And in 24 months, his reading improved. He was able to complete school. His mathematics improved. He could now do calculations 2000 independently. He could now go and help his father in the grocery shopping. Social interaction improved. Because he could speak complete sentence, he could communicate with others and peers. And then he could actually start cooking for himself at least and taking care of himself. That's a focus, that they should become more independent, and the mental age increased by 22 months. This is another 26-year-old young lady who came to us, who's now 30 plus now, who had difficulty in motor activities as well as motor planning, fine motor activity, difficulty in copying. She could speak, but her maturity level was much low. So after the treatment, improved coordination.
Very nice. Smells good, looks good, and with
she could do sitar, very difficult. She could learn the frequency. She could calculate and do with less mistakes. Confidence improved, a lot of improvement. So this is about intellectual disability, Down syndrome, though it is a chromosomal condition, trisomy 21, with other systemic issues such as heart condition could be there, thyroid and sometimes hernia. But all those others have medical and surgical treatments. What we treat is the brain functioning. We help to improve the brain functioning, improve the IQ of the child, improve the understanding, learning, and speech. So we focus on the brain functioning. We again see that certain parts of the brain are working less and they can be improved with cellular therapy. This is a 24-year-old girl, again from a very small town in Andhra Pradesh, who improved in her motor skills, color recognition. 24 years, she did not have the color recognition, fine motor, doing activities by herself, like simple things like combing, as we said, number and color identification, confidence in speech, helping in household activities, sequencing, tracing numbers, even. So 24 years, it was not possible. After the cellular therapy, this improved. So many such examples. Overall, if you look at the side effects, that's one of the things that people worry about, and have been told that bone marrow there are a lot of side effects, but using the bone marrow, in fact, there are no major adverse complications, no irreversible neurological deterioration. What we have seen is a possibility of 3 to 6% epilepsy in children or individuals who have a history of seizure previously or whose EEG is abnormal. Hence, we put them on prophylactic anti-epileptic medications to prevent or reduce the possibility of seizure, possibility of a spinal headache during the treatment. After the procedure, it is transient, may happen in 2 to 3 days in some children, but it is self-limiting. Nausea, vomiting or little pain may happen, and sometimes a little increase in hyperactivity is possible transiently, if for about maybe 15 days to a month. So this is NeuroGen Brain and Spine Institute in Navi Mumbai. You're all welcome. We treat our patients like our own family. We've treated 14,000 patients from about 100 different countries. We have all different therapies in one building. We are placed near a very beautiful lake in a city which is very well planned, without the hush-bush of Mumbai. People are afraid of Mumbai, but this is a little away from the main city, like a suburbs of Mumbai. This is our main operation theatre where the procedure is done. where this is a cell laboratory where the cell separation happens. And we have comprehensive rehabilitation, a combination of cellular therapy and neurorehabilitation is a team for a complete comprehensive holistic approach, which we feel is very, very important. And along with physiotherapy, occupational therapy, we have a specific Autism Child Development Center. We are in the process of now assigning a play area for children where they can learn as well as play. Aquatic therapy, spinal cord injury, walking track, especially for adults, sensory integration therapy, walk, play, speech language therapy, and our anti-aging branch or a NeuroGen annex, where we do cellular therapy as well as we also treat non-neurological conditions with other holistic treatments. We have published 18 books on various topics, both for professional as well as for caretakers, and this is our core group. We are accredited GLP, GMP, and these are our awards. So a holistic approach is very, very important. We believe that not one treatment is enough. It has to be a combination, but the right combination is important. To help you make a decision, please note these our website details and contact numbers. Each person is assigned a coordinator who will help you. We have a 1 week program and we have a 2 week program. 1 week will have only cellular therapy and rehabilitation. 2 weeks will have cellular therapy, rehabilitation, and integrative therapies. And how NeuroGen is different from others. Many people ask us, there are other therapy centers all over the world. What is different in NeuroGen? NeuroGen is different because our focus is only on neurological conditions. We do not treat any non-neurological condition in NeuroGen. Use safe cells from the patient's own body, which are autologous, and their focus is to improve the brain functioning, hence injected intrathecally. So we believe in a combination of cellular therapy with comprehensive neurorehabilitation and oxygen-based therapy. We've treated over 14,000 patients from more than 100 different countries in the last 15 years. We have a team of very senior, experienced professionals from the field of neurological treatments, both for cellular therapy as well as for rehabilitation, with who supervise all the work. We have the largest number of publications on cellular therapy and neurological condition in the world, not just in India, in the world. And we have written many, many chapters in various textbooks. We keep on constantly researching, adding what more can we do to help our children. And we have a government-approved institutional ethics committee which monitors all our work. So that's how we are different. So we believe that adult cellular therapy is safe and it is effective for children and as well as adults for neurological conditions, incurable neurological conditions. And if anybody has told you that this is not possible, that it's not possible to regenerate the brain, do remember what the father of our nation, Mahatma Gandhi, said, to believe that what has not occurred in history will not occur at all is to argue disbelief in the dignity of man. So it is possible.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So people remember the ban, but they don't remember the lifting of the ban. So that's why I thought I should play this video, plus the insight that Barack Obama had about the potential of these cells is not unfounded. It is true. He's talking about embryonic stem cell, but adult cells themselves have similar and better potential without ethical issues. So we hope that you're able to embark positively on the journey of hope with a combination of safe cellular therapy and integrative therapy. I hope this has helped clear a lot of the worries and doubts and skepticism that comes into our mind, because we hear all different sorts of negative connotation attached to this treatment of regenerative medicine. I hope this has helped you find the way back to hope and positivity. So this is where we are, and all of you are most welcome to get in touch with us. And I'm happy to take questions now. Let me see what questions have come.